What's up, guys? It's Dr. I, one half of the duo known as Twin Doctors TV, and July is Fibroid Awareness Month, and it is July, which is why I'm out here enjoying the beautiful sun. But because it is Fibroid Awareness Month, I figured I'd talk to you guys about fibroids. Fibroids are super common. A lot of people have heard of them, but I'm not sure that people know necessarily what they are or how common they are. So we're going to start with the what. What are fibroids? Fibroids are benign, so they're non-cancerous tumors in the muscle layer of the uterus. There are really three types of fibroids. The most common are what they call intramural, so they're actually in the wall of the uterus. They're also what they call submucosal, so they're more in the cavity of the uterus. And then what they call subserosal, which are more like on the outside of the uterus, kind of on top of the uterus. In terms of symptoms, the good news about fibroids, even though they are common, and by common I mean 80% of women will have them by the time they reach menopause, the good news about fibroids is that they are generally asymptomatic. So something you find incidentally, they're not causing problems, that's fine. However, if you're going to have symptoms of fibroids, the most common symptoms are A, heavy periods, frequently with clotting, prolonged periods, bleeding between periods, pelvic pain, pain with your menses, pain with intercourse, leakage of urine, urinary frequency, like when you gotta go, you gotta go. Some people report constipation, pelvic pressure, and back pain. These are the most common symptoms. Often, however, patients that have fibroids, especially if they're the ones that are kind of in the cavity, will have problems either becoming pregnant, so infertility, or maintaining a pregnancy. So they'll become pregnant, but they will frequently have miscarriages. So, if you suspect you have fibroids, what do? Well, of course, you go to your doctor. Now, the good news about fibroids is that they're easy to diagnose. If you go see your gynecologist, we'll do a pelvic exam. It takes 10-15 seconds. And if the uterus is enlarged, we're pretty sure that they're fibroids, 99.9% sure. However, we will generally order an ultrasound as well, just to confirm our diagnosis, make sure it's not something on the ovary, make sure you're not pregnant, make sure it is, in fact, fibroids that are causing the uterus to be enlarged. Sometimes they'll do a special kind of ultrasound called a sonohysterogram, which actually puts fluid in the uterus. And this is designed more to look for those fibroids that are inside of the cavity of the uterus. If you do in fact have fibroids, what are the options? Well, the good news is that there are tons and tons and tons of options. The most frequent option is what we call expectant management. Leave the fibroids alone. If they're asymptomatic, if they're not causing problems, don't mess with them. Generally, once you get to menopause, they'll stop growing, they'll shrink, no big deal. If you are having symptoms, however, there are a bunch of options. There are what we call the medical options. Generally, any medication that's given for birth control, so birth control pills, the Depo-Provera shot, the Mirena IUD, all of these have hormones, so they will, A, get rid of a lot of the symptoms, the pain, the irregular bleeding, heavy periods, things like that. And while they won't necessarily stop the fibroids from growing, we hope that they will at least make sure that the fibroids don't grow as much. They're also what we call the surgical options. Surgical options, now most people think, when they think surgery, they think hysterectomy, which is removing the uterus, and that is the definitive option. You take the uterus out, fibroids are gone, they're not coming back. But there are a lot of options short of hysterectomy. There's what they call myomectomy, where you take the fibroids out, leave the uterus behind. This is generally for people that want to preserve the uterus for childbearing, just because it's 50-50. Sometimes the fibroids stay gone, sometimes they do come back. There's also what they call uterine artery embolization, where they actually cut off the blood supply to the fibroids. Doesn't completely get rid of them, but it shrinks their size, reduces the symptoms. And then there's what they call radiofrequency ablation, where they actually use ultrasound waves to reduce the size of the fibroids. So there are tons and tons and tons of options for managing fibroids. Very common, however easy to diagnose, easy to manage. So that is fibroids in a nutshell. I'm going to put a little primer up on our website, www.twindoctorstv.com. Everybody hates when I say that, but I'm old school. I just say the www, but you know what I mean. www.twindoctorstv.com, and I'm going to put something up on fibroids. Thanks for tuning in, guys. If you have any questions, always reach out to us. Twitter, Twin Doctors TV on Facebook, or again, our website. And here it goes again, www.twindoctorstv.com. All right, guys, have a happy July.